The thing that completely upended everything that I knew as a psychiatrist, though, was when I helped a patient in 2016 lose weight. So this was a patient, 33-year-old man with schizoaffective disorder. He had been my patient for 8 years now.
Could you clarify for people what schizoaffective disorder is? I'm not a clinician, but as I recall, it's like a low level of schizophrenia. So there might be some auditory hallucinations. If I met this person, I might think they're kind of different, quote unquote, weird, but they would not seem necessarily at the scary to me and to typically to other people. And I mean that with respect, of course, but oftentimes people with schizophrenia can seem just like you don't even know how to interact with them because their world seems so altered. Because they have all these so-called positive symptoms, hallucinations, and they're talking to people that no one else can see, et cetera. Is that schizoaffective?
So no, actually, so schizoaffective is the same as schizophrenia, essentially. The only difference is it's schizophrenia with superimposed mood episodes.
Oh, so it's actually more severe than...
It can be.
Okay, so I have it backwards.
So schizoaffective disorder is essentially schizophrenia and plus some mood episodes.
Maybe I'm thinking of schizotypal.
Schizotypal is the low grade kind of mild paranoia or, kind of eccentric beliefs and other things.
Okay. So I folks out there, I have my nomenclature backwards. Schizotypal is the quote unquote low level schizophrenia or schizoid-like. Schizoaffective is as or more
full-blown schizophrenia plus full-blown, usually bipolar symptoms.
And now it's absolutely clear who the clinician in the room is. Thank you for that reminder.
No worries. So this man had schizoaffective disorder. He had daily auditory hallucinations. He had paranoid delusions. He could not go out in public without being terrified. He was convinced that there were these powerful families, that they had technologies that could control his thoughts. They could broadcast his thoughts to other people. They were trying to hurt him. They had targeted him for some reason. He wasn't quite sure why. He had some suspicions and beliefs about maybe when he did this bad thing when he was 11 years old, that's why they decided to target him. This man was tormented by his illness. Tormented. It ruined his life. He had already tried 17 different medications and none of them stopped his symptoms, but they did cause him to gain a lot of weight.
These are the medications, as I recall, for schizophrenia. The classical ones are dopamine receptor blockers, cause people to huge increases in prolactin. That's why sometimes men will get breast development and they'll put on a lot of weight and they'll be catatonic or movement disorders. They make you feel like, I have to imagine, given how good most things that release dopamine make us feel, that blocking dopamine receptors with antipsychotics makes people feel lousy.
Horrible. And it's a huge challenge in our field because a lot of patients don't want to take them. And then you get these rebound effects. If patients are on them for several months and then they stop them cold turkey, they can get wildly psychotic and ill, end up aggressive or hospitalized or sometimes dead. So that's him. He weighs 340 pounds. And for whatever reason, he gets it in his head, I'm never going to get a girlfriend if I don't lose some weight. He also recognizes I'm never going to get a girlfriend because I'm a loser. I'm schizophrenic. I live with my father. I have nothing going for me. But I could at least try to address one of these awful, horrible things about myself. And maybe I could lose some weight. So he asked for my help. For a variety of reasons, we ended up deciding to try the ketogenic diet. Now, at this point, I have no anticipation that the ketogenic diet is going to do anything for his psychiatric symptoms. Because this man has schizoaffective disorder. That's not depression. Depression is very different. They're totally different disorders. So he decides to give it a try. Within 2 weeks, not only does he start losing weight, but I begin to notice this dramatic antidepressant effect. He's making better eye contact. He's smiling more. He's talking a lot more. I'm thinking, like, what's gotten into you? Like, you're coming to life. Like, I've never heard you talk this much. I've never seen you so excited or present or alive. I haven't changed his meds at all. The thing that upended everything that I knew as a psychiatrist. Was 6 to 8 weeks in, he spontaneously starts reporting, you know those voices that I hear all the time? They're going away. And he says, you know how I always thought that there were all these families who were controlling my thoughts and out to get me and they had targeted me? And I'm thinking, oh yeah, we've been talking about that for 8 years. We could talk about that again. He says, you know what? Now that I think about it, I don't think that's true. And now that I say it, it sounds kind of crazy. It probably never was. I've probably had schizophrenia all along, like everybody's been trying to tell me. And I think it's going away. That man went on, he's now lost 160 pounds and kept it off to this day.
Wow.
He was able to do things he had not been able to do since the time of his diagnosis. He was able to complete a certificate program. He was able to go out in public and not be paranoid. He performed improv in front of a live audience. At one point, he was able to move out of his father's home and live independently. And that completely blew my mind as a psychiatrist. And I went on a scientific journey to understand what in the hell just happened.
That is indeed mind-blowing.